My research question is, does an increase in anterior pelvic tilt increase the risk of sustaining a hamstring injury? Hamstring injuries are the most prevalent soft tissue injury in Australian rules football. According to the AFL injury report, 21% of all injuries are hamstring injuries. This equates to 6 players per club per season sustaining hamstring injuries. The cost of hamstring injuries is estimated to be $1.5 million a season, or roughly 1.2% of the salary cap. When a player sustains a hamstring injury, they're usually sidelined for 4 weeks or 27 days. As you can see from the graph, almost 80% of all hamstring injuries occur while sprinting or in the acceleration phase of running, while the remaining 20% of hamstring injuries occur in the action of kicking or by other means. Burrell and others, 2003, found that of the 3 hamstring muscles, the biceps femoris was the most frequently strained. This occurred 81% of the time. Previous research into hamstring injuries have identified a range of risk factors. However, only 2 have been statistically proven. These being a previous history of hamstring injury and age, with older players having an increased risk of hamstring injury. Other plausible risk factors either require further or have conflicting research. These include quadriceps to hamstring strength ratios, lack of hamstring flexibility, insufficient warm-up, and fatigue. Several sources have identified anterior pelvic tilt as a plausible risk factor for hamstring injuries. These include Hoskins and Pollard 2005, Hunter and Speed 2007, Opar and others in 2012. However, no study has measured anterior pelvic tilt and its relationship with hamstring injuries. One study I did find, from Avizio and others in 1988, did measure anterior pelvic tilt. However, the purpose of their study was to establish tester reliability. The aim of this study is to investigate whether a correlation exists between anterior pelvic tilt and hamstring injuries. With the origin of the hamstrings being the ischial tuberosity, an increase in anterior pelvic tilt will cause an elongation of the hamstrings. In turn, this alters the muscle's length-tension relationship. So my hypothesis is, the greater the degree of anterior pelvic tilt, the greater the risk of sustaining a hamstring injury. Participants in the study will fill in a questionnaire covering general information as well as previous injury history. Part 2 will be the pelvic tilt assessment. The tester will identify and mark the anterior superior iliac spine, the ASIS, and the PSIS, posterior superior iliac spine, at which point the tester, using a check in kilometre which I have here, will measure and record readings from the left and right sides of the pelvis. Statistical analysis we will be using is Pearson's correlation coefficient. Potential limitations of this study include a sample size being too small to conclusively identify whether a correlation exists. The solution to this would be to increase the sample size by including a second team. Secondly, the accuracy of the equipment and the accuracy of the tester. The solution to this would be to ensure that the equipment is properly calibrated and each site is tested multiple times. In summary, it is not just Australian rules football that have high instances of hamstring injuries. Other sports, such as rugby, both union and league, American football, world football or soccer, and athletics are also plagued by hamstring injuries. This study will finally provide cumulative data about anterior pelvic tilt and the instances of hamstring injuries. This information will be critical to fields such as strength and conditioning and physiotherapy, both for the prevention and rehabilitation of hamstring injuries in the previously mentioned sports. Thank you.